Have you ever had a muscle twitch in your face that you could not stop? Most people have. It lasts a few seconds and disappears. Now imagine it never stopped for 2 years. A Minnesota woman named Tippy McInerny lived this exact nightmare. For 2 full years, the right side of her face twitched constantly, uncontrollably, getting worse every single week. She saw 8 different doctors. Every single one of them got it wrong. I'm Dr. Rayan, and this is Medical Detective. Tippy McInerny was an outgoing, social Minnesota woman, the kind of person who lit up every room she walked into. She loved people. She loved going out. She had a warm, easy smile that everyone remembered. In the fall of 2023, she was at her dentist, getting a routine filling on her right back molar. The dentist gave her several shots of local anesthetic and stretched her mouth open for over an hour. Standard procedure. She had been through it 6 times before. That night, she noticed something strange. A small twitch in her right eyelid, barely visible. She thought nothing of it. Probably tired, probably the dental anesthetic wearing off. She went to sleep. It did not go away. Over the following weeks, the twitch spread from her eyelid to her cheek, from her cheek to the corner of her mouth. The right side of her face began pulling sideways without warning, mid-sentence, mid-laugh, mid-meeting at work. She had no control over it. None. She went to her primary care doctor. He told her it was stress. She was prescribed relaxation techniques. The twitching got worse. She went to a neurologist. He thought it might be a tic disorder. He was wrong. She saw a second neurologist. Wrong again. A third wrong. Over 2 years, she saw 8 different doctors, and not one of them gave her the correct diagnosis. And as the months passed, Tippy's life collapsed around her. She stopped going to restaurants. She stopped attending social events. She stopped seeing friends because every time she went out, people stared. Some asked if she was okay. Some looked away. The outgoing woman who lit up every room became someone who refused to leave her house. Now here is what was actually happening inside Tippy's brain the entire time. And I need you to understand this because it is both terrifyingly simple and remarkably easy to miss. Your facial nerve, cranial nerve, 7 exits the brainstem and travels through the bone behind your ear before dividing into 5 branches that control every movement on one side of your face. Smiling, blinking, speaking, all controlled by this single nerve. In Tippy's case, and in the case of approximately 11 in every 100,000 Americans, a blood vessel near the brainstem had drifted just slightly and was pressing against the root of her facial nerve. Not cutting it, not blocking it, just touching it. That tiny, constant pressure was causing the nerve to misfire, sending random electrical signals to the muscles of her face without her permission. Without warning and without any way to stop it manually, this condition is called hemifacial spasm. And here is the most important part of this entire case. The MRI that showed the blood vessel touching the nerve had been taken by previous doctors. The image existed. The answer was literally in the scan, but none of the first 8 doctors had looked closely enough or known specifically what to look for at the exact right location on the brainstem. After 2 years, Tippy was referred to a specialist in hemifacial spasm. This doctor looked at her MRI, not a new scan, the same scan previous doctors had seen, and within minutes, he found it. A blood vessel pressing against her facial nerve at the root exit zone, right there in the image that had been sitting in her file for months. The treatment was a surgery called microvascular decompression, one of the most precise neurosurgical procedures in existence. The surgeon makes a small opening behind the ear, navigates to the brainstem, and places a tiny pad between the offending blood vessel and the facial nerve, separating them, ending the contact, ending the misfiring, ending the twitch. Tippy had the surgery. She woke up, and for the first time in 2 years, the right side of her face was still completely still, no twitch, no spasm, no pulling. The outgoing woman who had disappeared into her own house walked out of that hospital and back into her life. Here's what every American watching this needs to know. Number 1, if you have any involuntary twitching on one side of your face, especially starting around the eye and spreading downward, do not accept stress or anxiety as the explanation. Demand an MRI. Number 2, if you have already been told it is stress and the twitching continues or gets worse, see a specialist, specifically a neurosurgeon who specializes in hemifacial spasm and cranial nerve disorders. Number 3, the surgery for this condition has an 80 to 90% complete cure rate. This is not something you have to live with. There is a fix. You just have to find the right doctor. And if Tippy's story 2 years, 8 doctors, 1 blood vessel shocked you today, then subscribe to Dr. Rachel Rayan right now. New case every single day, real documented, American. And always something that makes you see your body and your health completely differently. So new case dropping tomorrow. I will see you then.